How common is depersonalization and derealization? Depersonalization and derealization are relatively common phenomena, especially if you consider them as temporary experiences. Studies show that up to 50% of all people experience an episode of depersonalization or derealization at least once in their life. They are often triggered by challenging situations, traumatic experiences, or drug use. These episodes are usually short-lived. Studies have shown that approximately 1 to 2% of the general population suffer from chronic and persistent symptoms of depersonalization or derealization that have clinical relevance. Chronic depersonalization or derealization is particularly common in young people up to 24 years of age. The average age at which symptoms begin is 16 years. About 30% of young people affected say that the use of illegal drugs, especially cannabis, is the trigger for their symptoms. What does chronic depersonalization or derealization mean? Chronic depersonalization and derealization refer to states of unreality or estrangement that either persist continuously over a longer period of time, this means weeks, months, or years, or occur again and again in an uncontrollable manner. Those affected describe the symptoms as intense and life-disrupting. Chronic depersonalization or derealization can have negative effects on other areas, such as social relationships or work situations. How long do episodes of depersonalization or derealization typically last? The duration of episodes of depersonalization or derealization can vary greatly from person to person and depends on several factors. The underlying causes, individual personality traits and strategies, for example, dealing with stress, as well as the timing, duration, and suitability of the treatment all play a role. Short-term episodes. In most cases, episodes of depersonalization or derealization only temporary. They last from seconds to a maximum of several hours and are often associated with a special trigger, for example, stress, panic attacks, or the use of illegal substances. Short-term episodes resolve on their own and do not require treatment. On-off, longer-lasting episodes. For some people, episodes of depersonalization or derealization can last for several days or weeks. This usually results in severe symptoms and a reduction in the quality of life of those affected. Even if such episodes often succeed on their own, early treatment or therapy can be helpful to be able to cope with the episode better and more quickly and, above all, to prevent further episodes. Chronic depersonalization or derealization. If symptoms of depersonalization or derealization persist for weeks, months, or years, or if the symptoms keep recurring in an uncontrollable manner, then the condition is said to be chronic. People are either affected by the symptoms 24/7 or live in constant fear of another attack or episode. The quality of life is usually significantly reduced. In cases of chronic depersonalization or derealization, therapeutic treatment should be started as early as possible.